Did you realize that mental illnesses are among the most common health conditions in the U.S. and more than 50% of adults will be diagnosed with some type of disorder during their lifetime? We are thankful to have Dr. Sajan with us this morning. She is the Chief Medical Officer from Health and Psychiatry, one of Florida's largest mental health care providers. Dr. Sajan actually completed her psychiatry residency at Northwestern Memorial Hospital in Chicago, one of the top psychiatric programs in the world, and joins us now.
Thank you for having me.
You know, in that, it's such important information that really shows mental health can affect all of us. And I feel as these conversations continue to go, it seems like society is talking more about mental health these days. Would you agree?
It definitely is, yes. The stigma that used to be there, it's definitely improving. People are more aware about it. People are more ready to talk about it and get the help that they need and they deserve.
Well, let's talk about how mental health, it doesn't just pick and choose which aspects of daily life or one's life it wants to impact. It can really impact the day-to-day, everything, right?
Yes, in the severe form, it gets to the point where a person is unable to function through their everyday life, unable to just like even get out of bed, take care of themselves, take care of their loved ones, maintain job, maintain relationships. And it just not just affects the one person, it affects the whole, the whole dynamics changes, the people around them. It affects all their loved ones. A lot of time people feel like they're in this deep, dark hole of gloom and they see no hope out there.
I like that you just said the word hope. I want to expand on that, if you will. And of course, I was just reading your credentials at the top of the segment there. Talk about, you've got the scientific background to be able to help and provide hope. Why is hope such an important word, and especially when it comes to helping your patients?
Because with mental illness, it takes a toll on our mental and emotional well-being. And one of the most common emotions that we feel is hopelessness. And a lot of time people think there's nothing out there. That's where hope is the word that is really, really important. It's one of the goals in my practice. We provide hope. We customize individual treatment plans. Other than our traditional medication management and psychotherapy, we also use the more cutting-edge, newer technologies that are out there. In our office, we use NeuroStar, TMS, and Spravato, which are FDA approved for severe depression that doesn't get better with traditional treatments. The results are very, very promising.
I think one of the things you said that was really interesting right there is how you customize each patient.
Yes,
I love hearing that with the different treatments to make sure that patient's getting the results that are beneficial, right?
Yes, because every person is different. Their symptoms, their life situations, everything is like different for every person.
Well, Dr. Sajan, before we run out of time and share information on how you can get in touch with her today, let's talk about the shame of getting help. I feel like that's alleviating. You already touched on the stigma at the beginning of the segment. I can really tell a difference in the conversations.
Yes, it's like there's so much more awareness now.
Yeah.
And social media has definitely helped. People are more willing to come forward, talk about it, and encourage other people to get help.
I'm so glad we were able to talk about it too today and help people who are watching at home. And if you are watching at home and want to go ahead, maybe take more care of your mental health, well, just go to the website you see on the screen right there. There's also the phone number. And Dr. Sajan, it's been a treat to have you on the show today.
Well, thank you. Thank you for having me.